Good afternoon, ladies and gentlemen. Thank you so much for joining us for today's webinar, Affordable Care Act 101, What the Healthcare Law Means for Small Businesses. My name is Emma Hollister, and I am the Network Manager at Small Business Majority. We are so pleased to be continuing this series with our partners at the Small Business Administration and the Center for Medicare and Medicaid Services. As a reminder, this is part of an ongoing series. We have been doing these throughout the summer and the fall, and we will be continuing them into the new year. So we will be releasing a set of new dates shortly, but we do have 2 more weeks left in this series. So if you have anyone who would like to participate or would benefit from these webinars, we will be sending out a link for registration for next week and the following week in a follow-up email after this webinar today. And then we will be sending out the links to register for the new series in the new year shortly. As a reminder, you should have received a copy of the slide deck that will be used today. And we will be sending out an updated version of that slide deck after the webinar today. So if you would like a copy of the presentation, you will be sent one automatically following the presentation today. Finally, this call is off the record. It is not intended for press purposes. So if you're a member of the press and you have a question and would like to speak to someone about the Affordable Care Act, you can do so. Please feel free to reach out to me. My name again is Emma Hollister, and I can be reached by email at ehollister, that's EHOLLISTER, at smallbusinessmajority.org. With that said, I would like to turn this call over to 2 fabulous Julies. We have with us Julie Varadi, who is an advisor at the Small Business Administration, and she will give the bulk of this presentation, and then we will also hear from Julie Kosterlitz from the Center for Medicare and Medicaid Services to give a little further information about the SHOP marketplace. So with that said, Julie, I'd like to turn it over to you. Julie Varadi from the Small Business Administration.
Thank you so much, Emma. I appreciate it, and thank you for having us here. So let's go on ahead and get started. So first, before I move on to the next slide, I want everybody to take a look at the screen in front of you. The red language on there is really important. We are going to be doing an overview of the Affordable Care Act and its impact on small businesses. But obviously, for every individual situation, you're strongly advised to speak with your own legal or tax advisor and consult professionals about matters that relate directly to your individual business circumstances. So hopefully, we'll be able to answer a lot of questions you may have. All right. So why are we talking to small businesses about the Affordable Care Act? Well, first of all, the Affordable Care Act impacts small businesses by giving you more opportunities to access affordable health care. And the reason why these provisions were put in the law in the first place is that the number one concern that small businesses have had over the years has been how they've been able to get access to affordable health care. You guys know this as small business owners, so I'm not teaching you anything new here, but small businesses generally pay an average of 18% more than their larger counterparts. And many times that's actually for lesser health insurance. And so the Affordable Care Act has provisions in it that are trying to help drive down premium cost growth and also increase access for small businesses to get quality, affordable health insurance. And so on this screen right here in front of you, the section on the left in the blue is, again, just talking about sort of the state of what it's like for small businesses with trying to get access to health care before the Affordable Care Act. You guys, again, you know this. There's not very many choices. Premiums tend to be higher. Rates increase unpredictably. There's price discrimination based off gender. Older workers and folks with chronic health concerns can really drive costs as well. Generally, there's a lot of waiting periods, and for people with pre-existing conditions, there's absolutely no coverage available at all. And so on the right-hand side of the screen, it's listing some of the provisions that the Affordable Care Act has put in place to protect small businesses and allow them to get more affordable health care. And the top 2 are ones that are already in effect right now. One of them is commonly referred to as the 80-20 rule. And essentially what that means is that insurance companies have to pay at least 80% of their consumers' premium dollars on actual Medicare. And so what that means is that they can't spend more than 20 cents for every dollar they collect in premiums on overhead and administrative costs. And if they do spend more than that 20 cents for every dollar they collect, they actually have to rebate and send that money back to the consumers that sent in the premium dollars in the first place. And the second bullet point there is talking about insurance companies now, if they want to increase their rates by 10% or more, they are now required to both publicly disclose that fact and then also justify why they need to be able to increase that rate by 10% or more. And now, starting in 2014, so just less than a month from now, some new provisions kick in. One of which is that, and I'm sure you guys have heard of this, but people are no longer going to be denied coverage simply because of chronic or pre-existing conditions. Insurance companies are no longer allowed to price discriminate based off gender, and they're going to face limits on how much more they can charge older employees for their premiums. And also, small groups are going to be able to actually pool their risks, so they're going to be able to have buying power, not unlike their larger business counterparts. And there's going to be annual dollar limits. There cannot be annual dollar limits on coverage, so insurance companies can't limit how much money they spend on their consumers each year. And also, all the new plans that are going to be offered will have essential health benefits. And really, there's two main ways that small businesses are helped out by the Affordable Health Care Act. One of which is tax credits, and the second is the new health insurance marketplaces. And when Julie from CMS takes over, she'll be talking about those health insurance marketplaces. So let's talk. I'm going to talk a little bit more about those tax credits in a couple of slides. But first, just some other general ways that the Affordable Health Care Act has helped many of Americans. Number one, I'm sure you guys have heard of the rule, and this has been around for a couple of years now, that young adults can actually be covered on their parents' health plans up to the age of 26. That's actually helped an additional 3.1 million young Americans get health insurance who were previously uninsured. Children cannot be denied coverage due to pre-existing conditions. Insurance companies can't drop you just because you become sick. The donut hole for Medicare prescription drugs has been closed, saving about $5.7 billion to seniors. And there's been a lot of, work done on electronic records reform. A lot of progress has been made, and that's continuing to grow to make it, in terms of administrative and logistics, a lot easier and a lot smoother and a lot cheaper for insurance companies. Okay, so we really wanted to sort of bucket this presentation based off the size of a business, because the two questions that business owners need to ask themselves in terms of figuring out how does the Affordable Care Act impact me are, number one, how many people work for me, and number two, how much do I pay them? And so we're focusing this presentation on that first question of how many people work for me. So the first part of this, we're going to be talking about businesses that have 24 or fewer full-time equivalent employees. And then we'll talk a little bit about employers that have up to 50 full-time equivalent employees. And then we're going to talk about folks that have 50 and above in terms of full-time equivalent employees. So first, let's talk about how does the Affordable Care Act impact businesses with 24 or fewer full-time equivalent employees. And the main way is by treatment of how the small business health care tax credit will impact you. So, what are the rules for the small business health care tax credit? Number one, you have to have 24 or fewer full-time equivalent employees. You must have average annual wages of $50,000 or less. And you as the employer have to contribute 50% or more towards your employee's self-only premium costs. And so this tax credit is available and has been available since 2010. And in order to get the maximum tax credit, I just want to note, is businesses that have 10 or fewer full-time equivalent employees with average annual wages of $25,000 or less. And again, they have to contribute 50% or more towards their employees' self-only premium costs. They have the ability to qualify for the maximum tax credit. And again, this credit phases in and out. The maximum credit available for tax years 2010 through 2013 is 35%. And a little bit more about that. So 2010 to 2013, like I said, it's 35% for-profit employers' premium contributions. And the other great thing about this tax credit is that employers can actually deduct the remainder of that contribution. So if you get that 35% tax credit, you can also deduct 65% remaining as a general business deduction. And again, this credit is available between 2010 and 2013, so those are 4 tax years. And then starting next year, so starting in 2014, the credit actually goes up to 50%. And the same rules apply, that you have to have 24 or fewer full-time equivalent employees, wages of $50,000 or less on average of your employees, and you as the employer have to contribute at least 50% of your employees' self-only coverage. The only extra rule that kicks in is that you have to purchase insurance through the SHOP, which is the Small Business Health Insurance Marketplace. And the other thing to note about this new enhanced credit is that it can be claimed for only 2 consecutive taxable years. So that doesn't mean you have to start taking it in 2014. You can take it in a later year. But once you take it, you have to take it the very next year. So if you're in a situation and you're looking at your projections for your revenue going forward, and let's say you think, I'm not going to actually be in the black until 2016, it would probably make sense to wait to take this credit until 2016, because then once you take it, you then have to take it again in 2017. And after you've taken it for the 2 years, it's no longer available to use. Now, again, this is a federal credit. There may be some states that have additional tax credits available. I'm not sure, but you should definitely check in with your local tax advisor and see if you can find out if there are state credits available for you as well. And this slide right here is just for those of you like myself who are visual learners. It's just, a visualization of what the rules are for the tax credit. Again, businesses with 24 or fewer full-time equivalent employees, average annual wages of $50,000 or less, and the business has to pay for at least 50% of the employee's self-only premium costs. For tax years 2010 to 2013, the maximum available credit is 35%. And in 2014, as long as you purchase insurance through the SHOP Marketplace, that max credit goes up to 50%. So businesses with up to 50 full-time equivalent employees. Again, there is no requirement to offer insurance. If you do choose to offer insurance, you will now have the new option to purchase coverage through the Small Business Health Options Program, the SHOP Marketplace. And for those of you with 24 or fewer full-time equivalent employees and who otherwise qualify under the rules, you may have the option to be able to get that small business health care tax credit. So with that, we're going to start talking about the Small Business Health Options Program. And I'm going to kick it over to Julie Kosterlitz from CMS. Julie, if you want to go on ahead.
Great. Thanks, Julie Verratti. This is Julie Kosterlitz from CMS and to talk about the SHOP program. And I appreciate the opportunity to be here today. We'll start with the next slide. For the discussion of the SHOP marketplaces, which start going into effect on January 1, 2014. This is a new way to offer insurance for small employers for 2014 and beyond. It's the Small Business Health Options Program, or the SHOP, sometimes called the SHOP Marketplace. It's open to those with 50 or fewer employees, as Julie said, in 2014, including nonprofit and religious organizations. The SHOP is part of the new health insurance marketplace, sometimes referred to as exchanges, which are available in each state. The marketplace must give small employers and their employees access to health insurance plans, and these plans must include a package of essential health benefits like coverage for doctor's visits, preventive care, hospitalization, and prescriptions. If you complete the enrollment process by December 23rd of this month, in 2013, coverage will take effect as early as January 1, 2014. Of course, you can offer insurance coverage to your employees anytime throughout the year after January 1, 2014 as well. It would take effect later then. The shop offers small employers health insurance choices and tools for making informed decisions. And as mentioned earlier, there is no requirement under the healthcare law for small employers with fewer than 50 employees to offer health insurance, nor is there any penalty for those that don't offer that insurance. It's basically a set of new options and tools and protections that are offered by the law, as well as the tax credits, which may also be available to help those who want to offer or are already offering employee health coverage and meet the requirements that were just described. Together, the new health insurance marketplace reforms and the tax credits are intended to help small employers overcome many of the traditional obstacles they've faced when they've tried to offer their employees health insurance. So next slide, please. So the main things that the shop offers to small employers is a choice of qualified health and dental plans, a meaningful comparison between these plans, and access to the small business healthcare tax credit, which, as we mentioned, is only available starting in 2014 through the SHOP program. And it offers extra information and help in addition to what's available through an agent, broker, or insurer through the toll-free SHOP Employer Call Center, which is listed on the slide at 1-800-706-7893. There's also a TTY number listed on the screen, and some extra help on healthcare.gov. Let's talk about, on the next slide, please, who can use the SHOP Marketplace. SHOP is open to small employers for coverage effective January 2014, including nonprofits and religious organizations with 50 or fewer full-time equivalent employees. In most states, the SHOP must use the full-time equivalent counting method to determine whether an employer is eligible. But as a transitional measure during this first year, in states that are running their own SHOP marketplace, insurers can continue to use the state's established method of counting full-time employees to determine which employers are eligible for the SHOP for plan years beginning in 2014 and 2015. Sole proprietors and shareholders of more than 2% of an S corporation with no common law employees, as well as the spouses of such business owners or shareholders, are considered individuals and can buy insurance through the marketplace but not through the SHOP. Next slide, please. So using the SHOP marketplace, when can you use it and how do you use it? You can start enrolling in SHOP coverage now. You have until December 23rd to enroll in coverage that takes effect as early as January 1. That means that employees who accept your offer of coverage must submit their enrollment forms to the agent, broker, or insurer by that date. You can also offer your employees coverage through the SHOP marketplace at any time during the year, as I mentioned earlier. If your employee enrollments are submitted between the 1st and the 15th day of the month, your group coverage begins the first day of the next month. So, for example, if your employee enrollments are submitted on February 10th, 2014, your group coverage through the SHOP would begin March 1, 2014. For enrollments submitted after the 15th of the month, coverage begins the second following month. So if employee enrollments are submitted on February 18th, for example, your group coverage will begin on April 1. For 2014, if you're seeking SHOP coverage for your employees in a state using the federally facilitated SHOP marketplace, you'll purchase that coverage directly from the agent, broker, or insurance company that offers a SHOP qualified health plan. This process is what we call direct enrollment. Important to note that online enrollment is not available in the federally facilitated SHOP in 2014, but will be available in November 2014 for coverage taking effect in 2015. That's when some additional new features to the SHOP will also be kicking in. We'll talk about that in a minute. A state that runs its own SHOP marketplace will have its own enrollment process and may be offering online enrollment this year. So it's important to check. If you're not sure which type of SHOP marketplace your state is using, you can find out from your agent, broker, or insurance company from healthcare.gov or by calling the SHOP Employer Call Center. Next slide, please. So let's talk about the federally facilitated SHOP and direct enrollment for a moment. Direct enrollment in a federally facilitated SHOP plan in 2014 is pretty similar to how most of you are probably enrolling in coverage today, if you're getting coverage at all. You work directly with an agent, broker, or an insurance company that offers a SHOP qualified health plan. And you can start by learning about the SHOP plans available in your area from your agent, broker, or insurance company, but you can also learn about these plans on healthcare.gov, which has detailed information about each SHOP plan available in your area and a new premium estimation tool that you can use without having to log into the account or fill out an application. A marketplace navigator or other assister can help you learn about the plans and use the website, but they can't advise you on choosing a plan or actually enroll your employees in a plan. So after you've selected a plan, you'll need to go to your agent, broker, or insurance company to get an exact price quote. And if you decide to go with this plan, you'll offer it to your employees, and those that accept will enroll directly with the insurance company or through an agent or broker, and ultimately through the insurance company. After your employees enroll, you'll pay the insurance company directly or through an agent or broker. You don't need to apply for or wait for SHOP eligibility before your employees enroll in a plan. And this is important. And we'll talk a little bit more about this, what SHOP eligibility is, what it means, and how to apply for it on the next couple slides. So next slide, please. So SHOP eligibility, what you need to know. Let's talk about what SHOP eligibility means in the federally facilitated SHOP. To be considered eligible for the federally facilitated SHOP, you must have submitted an application and been approved by the SHOP marketplace to meet the requirements of purchasing through SHOP coverage. That means the main reason this year is to get an eligibility determination from the federally facilitated SHOP in 2014 so that you can take advantage of the expanded small business healthcare tax credit if you also meet all the other requirements for the tax credit. States running their own SHOP marketplace may have a different eligibility determination process, so you'll want to check. If you want to have access to the expanded small business healthcare tax credit in 2014, you must receive an eligibility determination from the SHOP marketplace before you file your business tax returns for the 2014 tax year. Your employees also have to be enrolled in a SHOP qualified health plan, so make sure you check with your agent, broker, or insurance company when selecting a plan to make sure that you're getting a SHOP qualified health plan. I'm going to repeat what I said earlier, which is by using direct enrollment, the new process that we're using for small employers to enroll in coverage, SHOP coverage in the federally facilitated marketplace, you can choose not to wait for an eligibility determination from the SHOP marketplace before enrolling in a SHOP qualified health plan. This could allow you to get coverage for your employees more quickly and to take full advantage of the tax credit sooner, because you can claim the tax credit for the entire time your employees were enrolled in SHOP coverage during the tax year, as long as you get your eligibility determination from the federally facilitated SHOP sometime before you file your tax returns. If the SHOP marketplace determines you weren't eligible to participate in the SHOP after you've already enrolled, you wouldn't be able to claim the small business healthcare tax credit, but your insurance company isn't required to terminate your coverage, so chances are you can stay put in the same plan. Next slide, please. SHOP eligibility and how to apply for it. First of all, this is something that only the employer can apply for. It's not something that employees have to worry about. As an employer, you file an application for SHOP eligibility. And in the federally facilitated SHOP marketplace, if you're working with an agent, broker, or insurance company, they can help you get and fill out and mail in the paper application. There are also marketplace navigators or other assisters who can help you do this. And on healthcare.gov, there is a link that you can find that will help you locate a marketplace navigator or assister in your area. Or you can fill out and download the paper application from healthcare.gov. The website has instructions for completing the form and the mailing address, which is also listed on the application. Finally, you can complete the application by phone through the SHOP Employer Call Center. The federally facilitated SHOP Marketplace will notify you of your eligibility to participate in the SHOP by phone and email, as well as by mail if you ask. If you're found eligible, the SHOP will also send your employee enrollment information to the IRS to ensure that, as long as you meet all the other requirements, you can claim the tax credit for tax year 2014. You should get SHOP eligibility determination 3 to 5 days after the SHOP Marketplace receives your fully completed application. Next slide, please. So, how the SHOP works and the changes coming that are going to move us to employee choice model. One of the goals of the SHOP is to give small employers more options for their employees, including the option to offer employees a choice of health plans, much as their larger competitors often can. The SHOP in each state has some flexibility to decide which kinds of options it will make available to employers. In 2014, small employers in states with the federally facilitated SHOP Marketplace will be able to select only one of the available plans for their employees. However, states that are running their own SHOP Marketplace in 2014 may give employers the option to offer their employees a choice of plans. Many of these states are making an employee choice option available this year. Starting in 2015, the SHOP in all states must give employers the option to offer their employees a choice of health plans, at least at a single metal level that is chosen by the employer. Also starting in 2015 and afterwards, the SHOP can offer employers additional options, such as offering employees a single plan or offering employees a choice of plans in multiple different metal levels. I guess we didn't really talk about the metal levels, but these are different levels of kind of financial coverage that is explained pretty well on healthcare.gov. So I think that's the portion that that covers the SHOP program, and we'll be able to take some questions later. So I'm going to hand this back over to Julie Verratti. Thank you.
Thank you very much, Julie Kosterlis. All right, next slide. We are now going to start talking about businesses that have 50 or more full-time equivalent employees. And this is a part of the law called the Employer Shared Responsibility Provisions. Again, the remaining slides that I'm talking about under this section only apply to businesses with 50 or more full-time equivalent employees. And it's important to note that 96% of the firms in the United States are actually too small to be considered covered by these rules in the Affordable Care Act because they simply don't employ enough workers to be covered by these rules. So let's talk a little bit about definitions here, because that's obviously important. For purposes of the Employer Shared Responsibility Provisions, the definition of a full-time employee is an employee who works on average of 30 hours or more a week. Again, this is for purposes of the Employer Shared Responsibility Provisions. A full-time worker is someone who works an average of 30 hours or more a week. And I want to actually contrast that with the small business healthcare tax credit that I was talking about earlier in this presentation. The definition of full-time employee for purposes of the small business healthcare tax credit is defined as 40 hours per week. So right now we're focused on the Employer Shared Responsibility Provisions, and full-time employee is defined as someone who works an average of 30 hours or more a week. Another key definition is a full-time equivalent employee, which is either someone who's actually full-time and actually works at 30 hours a week, or it's a combination of employees, each of whom don't actually work 30 hours themselves, but if you add their hours together, it would count as 30, and that would equal one full-time equivalent employee. And obviously the regs and the law is a little bit more complicated and nuanced than this, but just for simplicity's sake, for example, if you have two employees, both of them work 15 hours a week, you would add those hours together to equal 30, which would then equal one full-time employee. So that's the definition of a full-time equivalent employee. Another important definition when talking about the Employer Share Responsibility rules is something called controlled group employers. And these are long-standing IRS rules, which essentially says that if you have common owners that have multiple businesses, those businesses will be related and aggregated together to determine the number of employees they have to see if they hit that 50 or more full-time equivalent employee threshold. And businesses that are in this grouping are probably not surprised by it because they're probably already filing consolidated tax returns each year for those businesses. But again, talk to your individual tax advisor for that. So there are two scenarios when an employer might be on the hook for making an employer shared responsibility payment, which is commonly referred to as a penalty. One situation is if an employer meets that 50 full-time equivalent employee threshold and decides not to offer coverage to their full-time employees and their dependents, and at least one of those full-time employees goes out onto the individual marketplace and gets a premium tax credit, that is a situation where an employer will probably be on the hook for making that payment. The second scenario is when you have an employer who has met that 50 full-time equivalent employee threshold, and they do offer coverage to their full-time employees. It's just that the coverage that they offered is either not affordable or it doesn't provide minimum value. And then one of their full-time employees goes out onto the individual marketplace, buys insurance for themselves, and ends up getting an individual tax credit. That's a second scenario in which an employer may be on the hook for an employer shared responsibility payment. So what exactly does minimum value mean, and what exactly does affordable mean? Minimum value is actually an actuarial calculation, but to define it sort of simply, it essentially means that all health insurance coverage that your plans that you purchase cover have to pay for at least 60% of the cost for any incurred benefits you have. So, for example, if you go to the doctor and the doctor checks you out and says, okay, that'll be $100, please, the insurance plan that you have has to pay at least $60 out of that $100 bill that the doctor handed you. So it covers 60% of the incurred health benefits. So you would be restricted to only paying 40% out of pocket for the coverage that you get when going to the doctor. That's what minimum value means. Secondly, what is the definition of affordable? Affordable is defined as a full-time employee not paying more than 9.5% of his or her annual household income on their self-only costs for the year. Now, again, that raises the question, how am I supposed to know as an employer what my employee's household income is? I have no idea, and that's right. There's no way you're going to know that. So the IRS created a few safe harbors, one of which is on the screen here. But essentially, if the cost to the employee, to the cost of the person that works for you, if their self-only plan is not more than 9.5% of the wages as reported on the W-2 that you send them each year, then you will have been deemed to have offered affordable coverage for purposes of the employer shared responsibility provisions. Okay, so let's talk a little bit about these payments that you might have to pay in a practical way. What does this look like? Okay, so for this screen on this slide, I want everybody to assume I'm talking about a business that has 50 full-time employees, and all of these employees are actually full-time. So I have 50 people that work for me, and all of them work at least an average of 30 hours a week or more. Scenario on the left, I've met that 50-person threshold, and I decide, you know what, I'm not gonna offer coverage to these folks. I'm not gonna offer coverage to my full-time employees. So what happens if employee number 17 goes out onto the marketplace and purchases insurance for themselves, ends up qualifying for that individual tax credit? That means I, as an employer, will be on the hook for $2,000 a year for every single one of my full-time employees, minus the first 30. So that means that if employee 17 goes out and gets that tax credit and nobody else does, it means that I will still have to pay $2,000 a year for employee number 31 through 50, because remember the first 30 are taken out of the equation. So that means that's 2,000 times 20 people. That's a $40,000 check that is sent to Uncle Sam that is not tax deductible. That's That's just what the penalty is calculated. And again, it's prorated by month, but I'm talking about this in an annual way because it's just easier math. Second example on the screen on the right, same company, but I decide I am going to offer coverage to my full-time employees, but it's either too affordable, it's not affordable, or doesn't meet minimum value. It's just not up to snuff. What happens if employee number 17 goes out into the marketplace, buys insurance for themselves, ends up getting that individual tax credit? I, as an employer, am going to be on the hook for $3,000 a year, but only for that employee number 17. It would just be paid for whatever employee actually ends up getting that tax credit on the individual marketplace. So that is how the payment is calculated in a practical way. Some other key points about the employer shared responsibility provisions. You do not have to cover part-time employees. If you offer affordable coverage that meets minimum value to your full-time employees and they decline it, you're not going to be owing a payment for that employee. Also, if one of your employees ends up getting coverage by means other than the individual marketplace, for example, let's say they're married and they're on their spouse's coverage, you're not going to end up paying a payment for that person. Because the thing that triggers the payment on the employer side is when the employee goes to the marketplace and obtains that individual tax credit. So in order to avoid the payment, employers just need to offer coverage to full-time employees and their dependents. And just so you know, for purposes of the employer shared responsibility provisions, dependent is defined as children under the age of 26. It is not defined as spouses. So just a few things about incentives. Again, when I was talking about those penalties, they are not tax deductible. Whereas if you contrast that with actually offering coverage to your employees, all the money you spend on offering insurance to your employees is a general business expense, and those expenses are tax deductible. And also in this day and age, when you're really trying to, there's competition out there, when you're trying to recruit the best and the brightest, offering a comprehensive benefits package is really going to help you recruit the workforce that you need, and also help you retain people as well. So a little bit about self-employed business owners. Starting January of 2014, so again, a little less than a month from now, there's also something called the individual shared responsibility provisions in the law. What that essentially means is that individuals are required to have minimum essential health coverage starting this January of 2014. So they either have to have minimum essential health coverage or qualify for an exemption or make an individual shared responsibility payment when you file your income taxes at the end of the year. So what is minimum essential coverage? That could be anything like employer-sponsored coverage. It would be coverage that you purchase through the individual marketplace, through healthcare.gov or your state's marketplace. Medicare, Medicaid, TRICARE, et cetera. Those are examples of minimum essential coverage. And sole proprietors, so again, business owners without a common law employee, you would purchase insurance, and I know Julie Kosterlitz talked about this, but sole proprietors purchase coverage on the individual marketplace. They do not purchase it on the shop. And that marketplace has been open since October 1st of this year. And again, if you want to get tax credits, you may qualify for them, but you have to purchase your insurance through the individual marketplace. And again, these tax credits for individuals and sole proprietors, it's based off income. It's a sliding scale. So for people who make between 100% and 400% of the federal poverty line, those are the folks that will be able to qualify for those premium tax credits. And you actually get them up front. So you don't have to wait until the end of the year in order to calculate how much money you'll get back. And so just to give you guys some real numbers, to give you some perspective, a single person for tax year 2013, 400% of the federal poverty line is someone who earns about $45,000 for that year. A family of four is someone who has a household income of about $94,000 for the year. So those are just some real numbers for you to think about when thinking about whether you might qualify for those tax credits on the individual level. And again, that's also why that second question business owners need to ask themselves, which is not just how many people work for me, but how much do I pay them? Because if you pay people really high salaries, they may qualify out of getting that individual tax credit, which again reduces the risk of larger employers having to pay the employer shared responsibility provision. Just a few other things. The W-2s, businesses need to start reporting what they pay for annual health care costs. However, if you file fewer than 250 W-2s, which is generally most small businesses, you're exempt from that. Businesses need to start showing a summary of benefits and coverage, letting their employees know about the healthcare marketplaces that are available. Waiting periods can't be more than 90 days starting in 2014. There are also some additional incentives and rewards for workplace wellness programs. For example, the smoking cessation programs that employers offer to their employees can net you about a 50% financial discount in terms of the premium costs for your employees' coverage. There are other workplace wellness programs that are available that are closer to 30% of a discount. Those are more behavioral and goal-type wellness programs. And again, in order for the IRS and HHS, et cetera, to be able to sort of, not track is the wrong word, but sort of make sure that things are smooth in terms of being able to figure out who offered coverage, who didn't offer coverage, who was able to get coverage, et cetera. Employers with 50 or more full-time equivalent employees starting in 2015 are going to have to start sending in reports saying what they offered and who they offered it to. And on the flip side, insurance companies are also going to have to send in that reports on who they gave insurance coverage to. And that also applies to businesses that have self-insured health plans. And again, those first reports aren't due till 2016, and that's because the employer shared responsibility provisions don't kick in until 2015. And with that, it's our last slide. These are just 3 websites that are extremely helpful, so we hope that you'll visit them to learn more. Anything we didn't answer today, please feel free to check out those websites. And with that, I guess we'll go into the question and answer section.
Great, thanks, Julie Verratti. Julie Kosterlitz and Julie Verratti, I think you guys both should have received some questions from our participants today. If you guys have any questions you'd like to answer, you can do so. Otherwise, I can ask a couple of questions of you from our participants.
So this is Julie Kosterlitz, and I did get a number of shop questions, and there are enough that are similar that I think it'll be good an opportunity to clear up anything that was perhaps a little confusing. So a couple people sort of asked that said that they had heard that the shop wasn't going to be effective until 2015, and so what exactly was the announcement or the functions that I was referring to earlier? So the writers or the questioners are correct that SHOP will not be available online, which means that you cannot actually either apply for SHOP eligibility or enroll directly in coverage, nor can your employees enroll directly in coverage online through the SHOP marketplace in 2014. Instead, we're anticipating that this will be available in November of 2014 for coverage that begins in the 2015. But what is still available is the SHOP eligibility determination, which will help you qualify for the small business healthcare tax credit if you meet the other requirements. So essentially, for enrollment purposes, you will be going through an agent, broker, or insurer that offers a SHOP qualified health plan. And you'll want to make sure that when you work with the agent, broker, or SHOP qualified health plan in the federally facilitated marketplace, because that's all we're talking about here, you'll want to make sure that you're buying a SHOP plan, a SHOP qualified health plan, because together, having your employees enrolled in a SHOP qualified health plan and having a determination from the SHOP marketplace, the federally facilitated SHOP marketplace, that you have met the requirements for SHOP eligibility are the two things required to be able to have access to the small business health care tax credit. So essentially, because the online functionality is not available right now for the SHOP, as we continue to work on improving the consumer experience for the individual health care marketplace, health insurance marketplace, you will buy your insurance much the same way you always have. You'll make sure you're buying a SHOP qualified health plan, and at your leisure during the year, but just sometime before you file your taxes, your tax returns in 2014 for your business, you'll want to get a hold of a SHOP eligibility determination, which your agent, broker, or insurer can help you do, or a navigator from the marketplace can help you do, or the SHOP call center can help you do. And you'll want to fill out the paper application and send that in sometime before you file your taxes. But for the purposes of enrolling, you don't need to have that eligibility determination in hand. You need to focus more on shopping for and enrolling in a plan and working through your agent, broker, or insurer. There are some great tools on healthcare.gov that can help you get the lay of the land before you actually make a decision, but you're going to need to enroll through an agent, broker, or insurer that offers a SHOP plan. So I hope that cleared that up. I'm going to let Julie Verratti make sure she gets some of her questions, and then there's one or two other SHOP questions here if we have time.
Thanks, Julie. So I'm looking at some of these questions, and I wanted to just sort of answer some of them. Well, one of them in particular, because we didn't spend a lot of time on this, someone was asking about information for nonprofit employers. And really the law actually covers employers generally. So if you are an employer, whether you're a nonprofit, you are a for-profit, you are a government entity, this law covers you. So there's no difference for nonprofits in that way. One thing that I can tell you about nonprofits specifically is the tax credit, the small business healthcare tax credit. So for tax years 2010 to 2013, nonprofits can have a maximum of 25% of a tax credit. And again, the same rules apply. You have to have 24 or fewer full-time equivalent employees. You have to pay annual wages of $50,000 or less. And then you as the employer, and in this case the nonprofit, you would be paying for at least 50% of the self-only coverage for your employees. And because you're a nonprofit, obviously you don't generally have any taxable income that you pay at the end of the year. So when you send in your 990, you would also send in another form, declaring what you, and I apologize, I don't know the name of the tax form, but obviously it's going to be available on the IRS website. You fill out the form claiming what you spent on the health insurance and assuming otherwise that you qualified for this tax credit. You would get it in the form of a refundable tax credit, meaning that you would get some of that money back from the government. And starting in 2014, the enhanced credit for nonprofits, it's the same rules as for-profits. It's just that your maximum tax credit is 35%. So it jumps up from 25 to 35%. And again, the same other rule kicks in that you have to offer coverage to the SHOP marketplace for your employees. So I wanted to make sure I addressed that nonprofit question. And again, someone asked about the definition of full-time equivalent. And let me just quickly say this, and then I'll kick it back over to you, Julie Kosterlitz. Definition of full-time equivalent employee for purposes of the small business healthcare tax credit is someone who works an average of 40 hours a week or more, or a combination of part-time employees that when you add up their hours, it equals 40. For purposes of the employer shared responsibility provisions, full-time equivalent is defined as someone who works 30 hours or more a week on average, or a combination of part-time folks that when you add up their hours, it equals 30 hours on average. I just wanted to answer those two, and then Julie, if you wanted to take the other SHOP questions, and then we'll probably end it from there.
Okay, great. So there was another question. If your state has a SHOP program, do you have to use that one, or can you use the federal SHOP program? And the answer is you need to use the SHOP marketplace that's offered in your state, in your place of business, your state. There was one that asked, is there a list that shows what the qualifications are for SHOP eligibility? And I would commend to you that you go to healthcare.gov because that's all spelled out there pretty clearly. And then finally, there was one, do I qualify for the small business healthcare tax credit if I buy my group insurance outside of the SHOP? It's the questioner notes that they've been buying insurance for years through a broker and asking, don't I qualify for the 2013 tax credit even before the SHOP existed? And answering the kind of in reverse order, the answer is yes, you would qualify, if assuming you meet all the other requirements to get the small business healthcare tax credit. You don't need to have bought through a SHOP in 2013. As you point out, there is not really a SHOP now, so you can apply for that this year without worrying about the SHOP. It's starting 2014 that the requirement to have purchased insurance through the SHOP kicks in. And I should point out that even if you've claimed a tax credit, the small business healthcare tax credit, any time since its creation, 2010, 2011, 2012, I guess that would be the 2011, 2012, 2013, you can still claim the credit for 2 consecutive years beginning in 2014. So you don't use it all up before the SHOP comes online. And I think this is all explained on healthcare.gov as well, but just something else to keep in mind. Back to you, Julie Verratti.
I think, for just to be respectful of folks' time, it's like 3 o'clock right now. I figure we could just cut it off from here. Emma, if you wanted to close it out.
Okay, great. Thank you so much, Julie Verratti and Julie Kosterlitz. We really appreciate it. Once again, ladies and gentlemen, we will be sending out a follow-up email which will include a copy of this updated slide deck as well as information about our upcoming dates in this series. If you would like to attend the presentation again or know someone who would benefit from attending it, we will look forward to speaking with you in the future. This now concludes today's presentation. Thank you. We're in the back room? Okay, we're in the back room. You turn off the recording as well.
Okay, great. Is it done? 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 Okay, great. Is it done?